Hi guys, Dr. Ashley here. As you know, we see miracles every day here at Prince Health and Wellness. We have our new patient, Mimi, and she's kind of a unique situation because she didn't have COVID, she didn't have a head trauma. She actually took a medication, which we both agree was a toxic medication. And ever since she took that medicine in 2019, right? She has not been able to smell. It's a basic medication that we all take for acid reflux, okay? So you gotta be careful with these meds. Now, I just did an upper cervical adjustment on her, and we're now testing her to see if she can smell. Would you have been able to smell peppermint before?
It has like very faint.
Okay, let's see what she smells.
Oh, I can smell it.
Is it like more vibrant?
Yeah.
Okay. And just keep in mind, we just did this.
Yeah.
Is 2 minutes ago. Okay, now smell this one. This is a little lighter. No. Okay, it's okay. Some people can't pass it. Okay, this was lemon. So let's try this one. This is our lightest scent.
Like a slight. Like
You can smell.
slight. Yeah.
What does it smell like?
Like cinnamon. Like the sweet, like cinnamon.
Like a sweet flavored coffee.
Yeah.
Would you normally be able to smell that?
No.
No. Okay, husband is saying no. So guys, we don't know how she's gonna progress. We're gonna be checking in with her, and over the next 24 hours, she could have huge changes. But this is what has taken place in 5 minutes. So if you know anyone who's struggling with taste or smell issues after having taken a medication, come see us. God bless you.